And doctors and advocates are shining a spotlight on what they call a grave humanitarian crisis in all of Ontario's long-term care homes. They say intervention is needed now more than ever, but the Ford government is still refusing to call in the military.
One senior is dying per hour, Doug Ford. I really hope you're listening to that.
The province's case numbers may be flattening, but the death toll inside Ontario's long-term care homes is on the rise. Take today as an example, more than half of the deaths coming from long-term care homes, and that has been the trend during the second wave.
This is gross incompetence, which has led to people's lives that were unnecessarily lost.
Staff shortages remain a significant problem inside homes like Roberta Place in Barrie, which is currently dealing with an explosive outbreak. 128 resident cases, 89 staff cases, and 50 deaths.
You kind of get tired of hearing how everything is fine. This is a complete failure from day one.
Jeremy Taggart's 73-year-old mother is one of the residents at Roberta Place infected with COVID-19. An inspection report at the home found a number of disturbing violations during the outbreak. For instance, staff were providing care to both confirmed COVID-19 positive residents and residents not confirmed to have COVID-19. The Red Cross wasn't sent into the home until more than a week after the outbreak.
There lies the biggest problem, the fact that people that really aren't trained for a crisis like this had to do this on their own.
We should have had a reserve force of health workers ready to step in at the first sign of trouble. We would never, ever allow this to happen in a child care center.
Advocates say this has been the pattern of preventable error inside homes since the first wave last spring. And today, they are again demanding the Ford government call in the military.
It is just completely inexplicable why our government is turning down that free assistance.
But in a statement to CityNews, a spokesperson for the Minister of Long-Term Care says the situation during the second wave is very different than the first wave when the Canadian Armed Forces were deployed due to a staffing collapse in some homes early on in the pandemic. Since then, our government has taken action to address urgent staffing shortages, including issuing management orders and enabling the deployment of hospital staff.
Give me a break. Give me a break. The situation is worse in the second wave. Things are worse now than they ever were before. In the first wave, hospitals did have the resources to come and save the day. They can't do that now.
When we hear that the staffing is normal or stable, we need to ask, what does that mean? How many PSWs do you have in the home?
Since the beginning of the year, 596 long-term care home residents and 3 staff have died.